Hello, this is Brenda Party. I'm the occupational therapist in Paoli, Indiana. My office is Southern Indiana Myofascial Release. Today's video will be for those of you with sciatic nerve pain. My best tips of what to do to keep yourself as pain-free as possible during this time that we're staying at home and are unable to get together in person for hands-on treatment. Those of you who see me in the office know that I am regularly checking your hip alignment to see if the bones are straight or crooked or tilted in one way or another. And so without me seeing you, you're going to be assessing yourself and taking your best guess. You can look at yourself in the mirror. Some people are able to tell if the bone on one side looks higher than the other, and sometimes it feels like you're scrunched on one side. Sometimes the hip bones are tipped in relation to one another. One's tipped forward. If you've been told you have a long leg, often it is actually that the pelvis is tilted so that the bone sits differently in that socket. So we're going to try to take our best guess of if we have a long leg or a rotated pelvis. So I will show you the exercises for those situations, and you can try them. If one of them helps you feel better, then that's the right one and the one that you should be doing. So here's the hip leg exercise. With one leg, usually the side that hurts the most, reach that leg like you're trying to make it like a telescope. Like a telescope that you make longer and longer and longer. Reach with the leg that's on the sore side and hike the hip on the other side. When I switch, you can see it better. Then I'm going to switch to the other side. You switch back and forth. And if one side, the side that hurts, if that feels really good to stretch that way, then hold it longer and give that side an extra turn or two. Then the technique, if one of the pelvic bones is rotated, you put your heel on your other knee. You're going to push with the top leg and pull with the bottom. So you're not letting your leg move. My foot is it's more comfortable for me to do this if I take my foot up off the floor, but you can leave your heel down if that works for you. I just feel like I get a better angle for me if I have my heel up, okay? And you can try both sides and see if one side or the other makes your back feel better. So that's for rotation and upslip corrections. Flattening and arching your back are good choices. And the very best piriformis stretch. The piriformis is one of the muscles that often is what's pinching the sciatic nerve. Bring your knee to your chest, toward the midline. Hold your leg and bring your foot up toward your shoulder. This should pull across the buttock. That very often is the best way to get rid of sciatic nerve pain. Other choices are to put pressure in the buttock with my favorite tool, the 4-inch inflated ball, and you just lay with some pressure into it. I can add more pressure by leaning more to that side. If less pressure feels better to start with because it's very painful, if you put a ball on each side, your weight's a little more evenly distributed and there's not so much pressure on the sore spot to start with, but that's a way to get started with that. Another choice is to use wedges. And you don't have these fancy pretty ones that I do, but a pair of tennis shoes will work. If this is the toe of the shoe and this is the heel, you can put those under your hips and lay on your shoes. The typical way to do this is the right side goes straight, the left side goes at a 45-degree angle pointing at each other, and in that triangle in the middle is your belly button. Okay, I will show you that in the process here. Okay, so I'm going to lay my legs down. The right one is straight across, the left one is at a 180 angle. And when I lay on them, it rotates my hips for me. So the right one's pointing at my belly button. My left one is pointing at my belly button as well, but it is on an angle. And then I just lay on my shoes and let gravity stretch the muscles around my hips. My knees can be up if that feels better. You get more pull usually with legs down, but sometimes that's too much. So do what you can do. Some other choices, other ways to use the ball are along the outside of your leg. Just lay on your side with the ball under your hip. Just keep looking for tender spots and apply the pressure into the sore spot. You can sometimes put the ball between you and the arm of a chair and kind of push into it sideways that way. You can move up and down. This is one big long piece of connective tissue that holds this muscle here at the hip down. Usually the whole length of that muscle needs to be released. You can use the ball in sitting or standing. So in sitting, I just put the ball under me in that sorest spot, if I can stand it, in the sorest spot. If that's too much pressure, if it hurts too much, I can move it off of center a little bit and just kind of go around the worst spot and gradually get so I can tolerate putting pressure right into it. Sometimes pressure into your low back because those muscles are typically tight when sciatic nerve is acting up. So 1 or 2 balls behind you when you're sitting, and again, you can put as much or little pressure into it as feels like it's getting some stretch, but not so much that it hurts, enough that you can't stay there for 2 to 5 minutes in each stretch position. A lot of the techniques that I've showed you with the ball, you could also use a swim noodle or another small roller. A fairly firm bolster pillow works. A good spot for some people is right below the sit bones, not right where the bones hit, but here, so you're stretching the tendons to the hamstring muscles. Sometimes that's a good spot for sciatic nerve pain, and actually all the way down the hamstrings. Again, this is a third of a swim noodle. I cut it into pieces because you don't need the whole length. And you just gradually work your way down, and with the swim noodle, with ball, with a rolled up pair of socks, with your fist, with a roll of toilet paper, whatever you have that you can use to put pressure into the muscles in the backs of your thighs, in the backs of your buttocks. I will show you what I mean about standing. If sitting on the ball is too much pressure, I can put it behind me and put pressure into the muscles in the buttocks this way. And again, I can control how hard I push back into the wall. My other tips would be to use ice or heat. If either one feels better, sometimes alternating a couple of minutes of one and then the other, and go back and forth with those. Usually you want to end with heat because heat is soothing, but ice seems like it often gets things to settle down after you've taken the ice pack off. Heat feels good while it's on, but it doesn't always have the sustained improvement that ice sometimes will. Okay, if you have questions, my phone number and email are coming up on the screen now. So feel free to get in touch. And I hope you are managing your pain while we're not getting together. And hopefully it'll be gone and you won't need to see me once COVID-19 stay-at-home restrictions have ended. God bless. Take care.